Can rhinoplasty improve my breathing? I'm Dr. Angela Sturm. I'm a facial plastic surgeon, and we're going to answer that today on Beauty Unveiled. Rhinoplasty can improve your breathing. If you had just a rhinoplasty and you said, my breathing's fine, I don't want to do anything about it, sometimes your breathing is actually better whenever I do the surgery. Because I'm a facial plastic surgeon, I'm ENT trained, I'm always going to think about your nose function first and then form second. And so I will put in the majority of my cases spreader grafts where I help widen a little area here that makes the shape of the nose look better and then also can help improve your breathing. There are people that will do things like preservation rhinoplasty where that dimension is kept the same and you're just shaping around it. Those are situations where your breathing is at least going to be the same, if not better. Or like I said, if you do structural like the way that I do, I always put those little spreader grafts. Most people who have some trouble breathing, that is a great time to address everything all at once. And so you may say, maybe a little bit at night, I don't know. And we'll take a look inside your nose and we'll be able to tell you if you have a deviated septum, meaning the divider between the two sides is off to one side more than the other, or if you have turbinate hypertrophy. And what that means is there's little structures inside the nose that heat and humidify the air, and they can swell and kind of stay that way if you have allergies, have irritation for some reason, you live in a place like Houston where there's a lot of irritants in the air, they just kind of stay irritated and we can shrink those down at the same time of surgery. Great time to address everything all at once. If you think maybe you have a harder time breathing or you know for sure you have a trouble breathing through your nose, those are things we can address all at the same time. We can straighten up your septum. It's called a septoplasty. We can reduce those inferior turbinates. We can put the little spreader grafts, which is called repair of nasal vestibular stenosis, technically, but things that we can do that would all help you breathe better, all at the same time. And the last one, the more complicated one, is usually incorporated in most of my rhinoplasties. So even if we did just the rhinoplasty, you should breathe better, but with a full evaluation in your consultation, we'd be able to tell you, can we do these other things at the same time? It doesn't add extra recovery time, and the way that we package our rhinoplasty, it doesn't increase your cost. It's just all one big package to be able to improve the form and the function of your nose. So you can make your consultation at www.drangelasturm.com or follow us on our socials at Dr. Angela Sturm.